Radiography of the paranasal sinus and the mastoid. So firstly we are going to look at the Waters view. So this Waters view is done. It is the occipito mental or the nose chin position. And here the angle is 37 degrees. This is done to check the maxillary sinus. Its main purpose is maxillary sinus. Next, it is also done for the frontal, ethmoidal as well as the sphenoid sinus. This is to the open mouth. Next, we are going to look at the Cadwells view. In case of Cadwells view, this is also done in the occipito frontal view or the nose forehead position. And the angle here is 15 degrees. The view is taken with the nose and the forehead touching the film. Nose and the forehead, it touches the film. And the X-ray beam is projected at 15 to 20 caudally. Now looking at the structures seen. The structures seen include the frontal sinus. This is the main. Next there's also the ethmoidal and the maxillary sinus. Next we are going to look at the Hertz view. Hertz view is nothing but the submental vertical, and here the vertex is near the film. The vertex is near the film and the X-ray beam is projected at the right angle of the film. X-ray, you can say, is projected at the right angle of the film. This is from the submental area. Now what is seen here is the Hertz view is specifically for the sphenoidal sinus. Next we are looking at the Reese view. In case of the Reese view, it is the lateral oblique and the zygoma, the nose and the chin, they touch the cassette, and the X-ray beam is directed posterior anteriorly at 40 degree, and this is at the mid sagittal plane. And here the structures seen are the ethmoidal sinus. So Reese, there are two E's, which is for the ethmoidal sinus. Next we are going to look at the lateral view. The lateral view, it is basically the lateral side of the skull. It lies against the film. It lies against the film, and the X-ray beam, you see, it's projected. It is projected perpendicular from either side. Now here what is seen is the frontal ethmoidal maxillary as well as sphenoid sinuses. Next we are looking at the Townes view. Townes view is nothing but the antero-posterior view, and here both the internal auditory canals, they are seen, and it is used in the acoustic neuroma as well as the apical petrosis. Next we are looking at the Skewer's view. Skewer's view is nothing but the 30 degrees lateral oblique, and here what is seen is the cholesteatoma, as well as there is post mastoidectomy cavity, as well as the mastoid abscess. This is seen.